Good morning. Good morning. Welcome to our monthly webinar for LT Senior Services. We're just going to wait for a couple minutes and let all of our attendees come in. We're so happy that everybody's here today on this cold, blustery day. If you happen to be in Austin, if you're in another city, which now with webinars you can. We have visitors come from Palm Springs, I think from Florida, New York. So that's one of the cool things about doing webinars instead of in-person events. But I know we all are dying to be in person again with everybody. I'm Cindy Cummings. I am a volunteer. I'm a volunteer with LT Senior Services. I am the president, and I help run things along with Natalie Harris. She's one of our most intricate parts of LT Senior Services. She helps in the background. And if I lose internet today, Natalie will be there and she'll come on and she'll help everybody out. We're just so thrilled that you all are here today. Our topic today is on RSV. And it was interesting. I had a lot of people email me and say, what's RSV? And I had to look it up. I had to Google it. Once I read about it, I thought I need to know more about it. So I'm super excited that you are here too to learn more about that. But without, we're not going to go into the webinar first. We want to talk a little bit about LT Senior Services. So LT Senior Services is a nonprofit. We're a 501c3. We help older adults in the Lake Travis area. Lake Travis is located just outside of Austin. And the way that we help older adults is we have educational events and we have other events that we do throughout the year. We hold webinars. We used to hold them in person at the Lake Travis Library. Loved it. Lake Travis Library, one of our favorite partners. But with COVID, we weren't able to do that anymore. So we started doing webinars right after COVID started. As a matter of fact, I think we were doing webinars almost once a week. So we were doing a ton of webinars because there was so much information that needs to get out to older adults and to their families. So that's one of the things we do is webinars. We hope to be back in person. For now, we're going to stay in webinar mode. All of our webinars will be recorded and you can find them all on YouTube. So if you happen to miss a webinar or you want to go back through, you can go to our YouTube channel. And it sounds so fancy. I love this. Now we're doing Zoom and YouTube and all those things, but it really is great. If you find a topic interesting, you can go to the YouTube channel and you can share it with your loved ones or your friends. We also have, gosh, I guess 2.5 years of webinars there. Don't judge in the beginning. We really didn't know how to do the Zooms. We're getting a little bit better. Look at our little fancy panel here. So we're super excited for this new year and 2022. Our February topic we have, and since it's February, it's a month of love, our topic is going to be love and marriage is not just for youngsters. So we're going to have a lot of specialists who will come on and they're going to talk about not the pros and cons, but just kind of the ins and outs of maybe finding love at an older age. We hope to talk about lots of different things. It could be financial, legal, and also how to meet people as you age. So that's going to be our February topic. We hold shred days. We hold them 2 times a year, and we typically hold them around tax season time. So we don't have our date confirmed yet, but it will likely be March or April. These shred events are free. We hope that we can get donations. It's one of our, well, it's our biggest fundraiser. And we've helped lots of different companies. You can bring however much you have, and we just hope that you'll give us a donation to help pay for the cost. We use a really great company. They take all the paper, they put it into locked containers on site. They lock them up, they put them on a truck, and then they shred them in a manner that we feel is very safe and applicable for people if they have financial or legal documents and things like that. But I also just take my Visa receipts. We will have our Aging Well Expo, and that will be September 27th. We've already booked the date. It will be at the Lake Travis Lakeway Activity Center, and it will be live. And that live event, we'll just kind of, as the time comes closer, we'll decide if we can do it live or not. But our intention is to be live. With our webinars, if we decide to go live, what we'll do is we'll do a dual or a hybrid. So we'll have it both live and we'll have them in person so that people can still attend them. We also have some other great projects that have been on our plate, and we've been kind of working on them, but we hope that we'll get more volunteers to help us with those. But one of them is property tax exemption assistance. We have heard that there is a big problem financial problem for people to be able to stay remaining in their home. It's not only just making sure that the home is safe, but financially, it's difficult to stay in your home financially. So we have heard that there's many people who do not have the proper exemptions. And so we held a property tax exemption day, and we helped a couple people. I think we helped 4 people get their property tax exemption correct. And that could impact you as much as, $500 to thousands of dollars. So we feel that by helping older adults make sure they have the proper exemptions that allow them to stay in their home longer, we're really excited about helping with that issue. Our next is emergency preparedness. And, because of COVID last year, we learned we need more preparedness. And we hope to be able to have packets or things like that later that we can distribute. So those are just some of the fun projects that we do. We have 46 members in LT Senior Services. We are a nonprofit. We do have for-profit businesses. For example, I'm a realtor, and we have financial people, lenders. We have just a ton of services that are important for older adults, from hospice to companion care to assisted living, independent living communities. We have a ton of members, and they bring a lot of knowledge. And that's where we get the basis for our webinars, is from our members. Our speaker today is Dr. Carlson, and he is one of our members. He is one of our first members. So we have 46 members in 2022, and who knows how many we'll have in that was in 2021. So who knows how many members we'll have in 2022. So I'm going to ask Natalie. Natalie, do we have any members that want to introduce themselves? I'm going to check on my phone too.
We do. We have Karen from the library.
Awesome. Karen, you want to come in and tell us what's going on at the library? It's always great to get an update from you. I know you guys are constantly having to, what's the word? I say rejuge a lot, but I don't know if that's really the appropriate word. So tell us what's going on at the library. Hey, Karen, happy 2022.
Yeah, it's great to see you all. Thanks for having me. Excuse me, and thanks for everything you're doing for the community. Yeah, I'm at the library. I'm in the kitchen. I'm just not in the stack, so everyone can't hear me talking. But the library is open. You can come in and browse. Excuse me. We're open 10 to 7 Monday, Tuesday, Wednesday, and 10 to 4 Thursday, Friday, Saturday. And then this year in 2022, we just started, as Cindy was talking about, different programs. So we have our calendar published now, so we have a mixture of some in-person programs, some outside programs, some online programs, and then hybrid, both in-person and online. So take a look at the calendar and see if there's something there, and then there should be an indication of what kind of program it is. We also have the tech coaches that are back in the library Monday, Tuesday, Wednesday, Thursday from 12 to 2, and they're in person if you can bring a device or your phone or your computer and get some help in person with someone also.
That's awesome. I know a lot of people are having to relearn some of their devices and use them in different ways that they never thought they'd have to. So just being able to log on to Zoom, I know our first month, I was like, oh my gosh, how are we going to figure this out? But now here we are. Is it 2 years later?
Yeah.
So we're getting a little better at it, but it's so great that you offer that assistance and it's free. So
yes, absolutely. Yeah. So we're just slowly trying to get things back, but it's all volunteer. Everyone's wearing masks. So we're just trying to go with the flow of how the world is going.
We're just doing the best we can do. That's kind of our motto too. Well, Karen, it was so great to see you, and thank you again for all of your support. And just go to the library website and you can see all the different events there. Okay, thank you.
Thank you.
Thanks, Karen.
Thanks.
All right, Natalie, do you see anybody else coming on board that want to introduce themselves?
I do not.
Okay. Well, what I'd like to do is introduce a good friend of mine. Anne Maloli is going to come on the screen. Anne has been really a person that helped get LT Senior Services off the ground. She was one of the founding members, and she was on the board. She's still on the board, but she doesn't know that. By the way, you're still on the board. But she was one of our founding members, and she just understood how important it was to have a group like this that could help older adults. And so Anne is here to introduce her what would you call it, co-worker, I guess?
Yeah, my colleague, Dr.
Yeah, your
Carlson.
colleague.
Yes.
Yes. So
Thank you.
Yes, I'm going to go off screen, and if you would just go ahead and introduce Dr. Carlson.
Okay, thank you, Cindy. Happy New Year, everyone. Yes, this organization has been a blessing to all the organizations that participate in Senior Services, and I know it's been a blessing to a lot of seniors that the organization has helped. So we're very proud to be a part of it. And I'm proud to introduce to you my colleague, Dr. Mark Carlson. He is a fellowship-trained, board-certified geriatrician, internist, and oncologist. Prior to his move into geriatrics, Dr. Carlson spent about 20 years in medical oncology. And this is really where he honed his skills in clinical expertise, in compassion, and developing a trusting patient-doctor relationship. So he combined these skills with his real strong desire to help seniors in the aging process, and he created Be Well MD. So Be Well MD is the organization that I'm also representing, is an in-home medical practice. It's designed specifically for aging adults. Dr. Carlson meets with his patients in their homes and virtually. The key components of this in-home service really are the customized, very personalized senior health care that he provides, the convenience, and the accessibility. Clinical research has been a cornerstone of Dr. Carlson's career as well. During his tenure in oncology, he participated in drug trials leading them to approval for treatments that are now being used in the clinic setting today. So with his focus in senior health, Dr. Carlson recognizes that the advanced treatments that are desperately needed for dementia and other senior-related conditions. So this is now a primary focus in his role as a geriatrician, and it's also the driving force for creating Be Well Clinical Studies, which is a medical research company. So now he had Be Well MD, which was started about 7 years ago, and now Be Well Clinical Studies. So with that introduction, I'll turn it back over to Cindy to get the conversation started.
Thank you, Anne. It's great
Thank
to
you.
see you, and Happy
Thank
New
you.
Year to you too.
All right.
And there's
have
the
a
good
session.
doctor.
Thanks, Cindy. Thanks, Anne. Thanks, Natalie. Before we start, I just want to give a round of applause virtually to Cindy and Natalie for the work that they do. I've been privileged to see this organization grow over the last several years. And yeah, the work that you do is to be commended. And thanks for letting me be part of it.
Oh, thank you, Dr. Carlson. We really appreciate it. We're so happy to have your knowledge in your brain that you're able to share with others. The way that you speak is so inviting, and it's so informative, and we can understand what you say. So we're so happy that you're here today, and we're talking about a topic, like I said, I had no idea anything about it. And so I'd just like to start off by asking you, what are the risks of contracting RSV?
Well, let me start with a little bit of background regarding RSV. You mentioned in the beginning that you had to look it up, and I think most of us, or many of us, have probably heard about RSV during the course of our lives, just in talking about health and/or disease. But most have heard about RSV literally. If any of us have been around children and experienced a child with croup, you have heard RSV, because croup is caused by RSV. And RSV is a disease that almost everybody contracts by the time we're 2 or 3 years old. But the problem with RSV, kind of like COVID, is that the immunity that we develop is not lifelong. So for instance, other diseases, mumps, measles, if you get that disease, it usually confers lifelong immunity so that you don't have to worry about getting it a second time. It's not 100%, but most of the time that's the case. But with RSV, unfortunately, even though you get it almost always as a child, unfortunately, then when we get older, we're still at risk. And so other risks surrounding RSV are age, and that's probably one of the biggest ones. But then there's also an immunocompromised status. And then if you have respiratory disease, because almost always RSV infects the respiratory tract, somewhere between the upper pharynx or the back of the pharynx down through the lungs. And it's really that risk with other lung disease like asthma, emphysema, chronic bronchitis, bronchiolitis, other diseases like that, that really increase the risk and make this an important topic for elders.
Well, I think you have some slides. Did you want to show us those slides now?
Yeah, sure. I'm going to try to combine a whole lot of different information here to lead us to the point where there's an action item for the participants. I suspect that many of the participants are in their elder years, i.e. getting into the 60s, 70s and beyond. And RSV has been a disease that the World Health Organization and the pharma companies have identified as an important disease to try to prevent. And I want to talk a little bit about not only RSV prevention, but just vaccines in general, proteins, antigens, antibodies. And in this world of COVID, I think many of us have heard about these things and maybe not had a good understanding. So I'm going to share a few slides just to help everybody understand what we're talking about when we when I use these terms: proteins, antigens, vaccines, etc. So I'm going to try to bring up the presentation. Okay, so first of all, what are proteins? Everybody knows what a protein is. Of course, when you eat a steak, when you eat seafood, you're eating proteins. And of course, it's not pure protein, but that's the main dietary source. But in the body, the proteins are made up of amino acids. And can you see my cursor?
I don't know. Can I see your cursor? Yes, I can see your cursor.
Okay, so these little circles at the top represent amino acids, and most of you have heard about amino acids. Amino acids are small molecules, and then when they're combined in chains and then combined or configured in complex arrangements like this, that's what we're talking about regarding a protein. So proteins are just complex molecules made up of chains of amino acids. And the protein is where all the action is happening in biological systems. The proteins act as enzymes. They transport other elements in and out of the cells. They can act as signaling molecules. They're part of the immune system. And so almost everything that happens within disease processes and within medicine ultimately boil down to the work of the protein. And so I wanted to share that just to give you a little bit of background. And now let me share a little bit about antigens and antibodies. So in the world of COVID, if this was a COVID molecule, this little spike here would represent the spike protein. And the spike protein is what we call an antigen. And an antigen is simply a protein on the surface of a pathogen. In this case, we're using the example of COVID-19, or it could be RSV, or it could be a bacteria like pneumococcal pneumonia or meningococcus. And so any pathogen, whether it's a bacteria, a virus, a fungus, a parasite, can be a pathogen that presents an antigen to the immune system. And then this is the working point that the immune system goes after. So this is the identifying protein that the antibody attacks. And the antibodies, of course, we've all heard about that. And antibodies are basically complex proteins that recognize the shape of an antigen, and then they can latch on together. And I'll show you another slide that maybe demonstrates that, where the antigen antibody interaction causes the reactions within the immune system to fight the pathogen and get rid of it. And this is a complex system within the body. And this is basically your immune system at work. And so, for instance, well, let me go back here, sorry. In the current world of COVID, you've got a COVID pathogen with a spike protein, and then the vaccines that most of us have taken, or many of us have, induces our immune system to produce antibodies against the spike protein that takes care of COVID. Now, in the case of RSV, we don't have a vaccine to induce this kind of process, and that's what we're leading to. And so now let me switch gears and talk specifically about RSV. RSV stands for respiratory syncytial virus. And like I mentioned earlier, it causes childhood diseases like croup and infections in the trachea, infections in the lungs, pneumonia. And it is the number one cause of hospitalization in infants. And then in the elder population, we're learning that it is a very common cause of hospitalization and death in the elderhood population. And regarding that, worldwide, we've got about 165 million people every year that are infected with RSV, elders that are infected with RSV. And there are hundreds of thousands of deaths. And in the United States, we estimate that there's about 200,000 elders hospitalized every year, and approximately 10% of them will die. So that translates into about 20,000 deaths every year from RSV. And this antibody antigen reaction is something that we do know with RSV does occur. But now we want to try to find a way to create this with a vaccine within RSV to prevent all those hospitalizations and deaths within the elderhood population. So we're very aware during this pandemic of how devastating these viruses can be. RSV is absolutely one of these diseases that we may not be as aware of we may not be as aware as we are with COVID-19, but it is a very substantial problem. And to point out some of the value that we get from vaccines, let me mention a few diseases that at the turn of the century were devastating, and that as a physician now for the past 30 some years, I have never seen. Tetanus, rubella, polio, mumps, measles. Well, excuse me, I've seen one case of measles. Whooping cough, pertussis. Now I have seen 3 or 4 cases of that. And in fact, one of my members was just over the Christmas holiday exposed to whooping cough, and we had to treat her prophylactically to prevent it. But all of those diseases, along with about a dozen more, have been largely prevented because of vaccines. And if you look at the world history of medical advancements, the last 100 years have been incredible, and our lives are dramatically better and longer because of these medical advances. And of all the medical advances that we hear about every day, that we take advantage of every day, regarding surgeries, robotic therapies, all of the technical advances that we see in the hospital, chemotherapy, medicines, radiation therapy, all of those advances pale in comparison if you look at the benefits compared to vaccine therapy. And vaccines are by far and away the best return on investment that we've seen. And it is very important for us to continue this work. The World Health Organization has identified RSV as one of those diseases that we want to focus on. And so that's why it's an important topic for all elders, and I suspect for this crowd as well.
Well, that's super interesting. I didn't know about the croup, and then I didn't know about the number of people who have passed away. Can you relate the number of people who passed away to some other disease so we can get a good sense for that percentage or number of people? I think you said 20,000 people a year.
Yeah, so if we lose 20,000 people a year secondary to RSV, it's probably not fair to compare to COVID. This year, or since the pandemic started here in the United States, I think we've had close to 800,000 deaths to date. And so but that's not going to be a fair comparison because RSV is not in pandemic, but it probably will be a fair comparison 2, 3, 4 years from now. Because with the pandemic and COVID-19, with the herd immunity that we're approaching, COVID-19 is going to become endemic, sort of like RSV is, meaning that it's going to be in our population. It is going to be something that we live with for the rest of our lives. And now we just have to find ways to manage it. Now we find ways to prevent it, try to find ways to treat it. And so 3, 4, 5 years from now, hopefully COVID-19 will be brought down to annual death rates below 100,000. Diseases right now that are causing 20, 30, 40,000 deaths annually. Breast cancer, I think, causes about 100,000 deaths. Colon cancer, 50,000 deaths. So that gives you a little bit of an idea.
Yeah, just kind of put it in perspective because I never heard of it. I'm, I can't be the only person. I know I'm not the only person. Well, what are some ways that you can treat it?
Yeah, and unfortunately, we don't have any ways to treat it. And that points out why you may never hear about it. Because we don't have a specific treatment for RSV, meaning we don't have a drug that I can give my patients when they come down with RSV, it's sort of a moot point. Meaning, if you get RSV, heaven forbid, Cindy, and you land in the hospital, your doctors are going to be looking, or let me back up and use a different example. If you develop pneumonia and you get admitted to the hospital, your doctors are going to be vigorously looking for treatable causes of pneumonia, i.e. pneumococcus, Klebsiella, Haemophilus. There's so many others that are treatable. And so we, generally speaking, don't test for RSV. We don't test for adenovirus. We don't test for other viruses or other diseases that we don't have a treatment for or a specific treatment for. So in other words, if you have pneumonia, everybody is going to get supportive care, meaning we're going to give you IV fluids, we're going to give you oxygen, we're going to give you good nursing support, physical therapy, those sort of things that everybody with pneumonia will get. If you've got a bacteria like pneumococcus, we'll give you an antibiotic in addition. But if you've got RSV, unfortunately, we don't have a specific medicine for that. And therefore, we won't test for RSV. And that points out why many of us haven't heard about RSV, because even though it is a common pathogen, a common reason to end up in the hospital, we don't know about it because we don't test for it. And so the reason that we do know how bad a problem it is because of the research studies that have been done demonstrating the problems within the hospitalized community and why this is such a big problem. And because of those studies, the World Health Organization and the CDC realize that we need to prevent this disease. And we are working on treatments as well, but the treatments are difficult, just like we know with COVID-19.
Mhm. So how can you prevent it? I guess that's what we got to do, is try to prevent it. So what can we do?
So the first things for prevention are the common things that we're doing with the pandemic. Good hygiene, good cough hygiene, rather than this. And those go a long way, especially with RSV. In fact, with RSV more so than with COVID-19, because RSV is typically communicated or infected by direct touch rather than aerosolized. Now, there is aerosolized transmission of RSV, but it's in big droplets rather than the microscopic droplets that is associated with COVID-19. And so regarding RSV, we have seen a significant drop in the incidence during the pandemic because the masks are more effective at preventing RSV than they are in preventing COVID-19. But those are the first line of defense, the practical measures of good hand washing, good cough hygiene, etc. And then beyond that, we really don't have, well, excuse me, there is one, and I've got to write this down. I've got to look at my notes. Synages, and you've probably never heard of it. I never heard of it prior to me preparing for this discussion. It is a monoclonal antibody, and the generic name is palivizumab. Palivizumab was developed as a specific treatment. And if we go back to I'm going to share my screen one more time.
Oh, sure.
So the palivizumab, well, I can't, I'm still disabled.
Oh, shoot. Sorry about that. Hold on one sec. There you go. You should be good now.
So the palivizumab, are you seeing the pictures now?
Mm-hmm.
Okay, the palivizumab is one of these monoclonal antibodies. And so it's a laboratory created protein, complex protein, that is an antibody basically that reacts to the RSV antigen. And I believe in the RSV, it's not the spike protein, but the F as in Frank protein. The F protein, this monoclonal antibody Synages, is directed against that protein. And this points out another problem with this kind of treatment. These proteins are big molecules. They're not tiny, they're not simple, and they can't be given in oral form. If you take a monoclonal antibody and you swallow it, then your stomach acid will totally denature, which is a medical term for ruining or destroying the protein. The protein is denatured in the stomach and it has no effect clinically. And so these monoclonal antibodies, and we know about this with the pandemic as well, have to be injected or infused. And so there's multiple complexities regarding delivering a monoclonal antibody as either a prevention or treatment. They're hard to give, they have to be injected, they're very expensive, they're hard to handle. And for all those reasons, the palivizumab is not something that we give to everybody. And so if you unfortunately have a child who has a known immunodeficiency, that is a child who is particularly susceptible to RSV, complications, and death. And so those individual children are treated with monoclonal antibody on a Q 2 to 3 month basis. Every 2 to 3 months, they'll go into the office and they'll get an injection into the butt of Synagis, and that will help boost their immunity, their added immunity, so that they can survive RSV. Now, we don't have the equivalent of Synagis in the adult population. And so we understand how difficult it is, so that even if we did have it for the adult population, it would not be a broad-based solution, because so many individuals would need to be treated, and the cost of it and the complexity of delivering that prevention for the population is just too great. And so therefore we wouldn't even try to do that. It's just too daunting. And so the World Health Organization and the CDC are focusing on a different form of prevention, and that's in the form of a vaccine. Just like we're working on and have provided the COVID-19 vaccines, we're doing the same thing with RSV and multiple other infectious diseases at the present time.
We do have a question, this is something I need to let everybody know who's participating today. Please ask questions. We will ask the doctor the questions, but her question is, are they working on a vaccine for RSV? And I think that's kind of what you're talking about. But
yeah, exactly. So again, the World Health Organization it's not the official United States organization that organizes this. In fact, there probably isn't any official organization that organizes these vaccine development projects. But the World Health Organization and the CDC and the other equivalents around the world, they help to identify which diseases are causing the most problems. And then they make the recommendations about where to focus our energies. And so, yes, RSV is near the top of the list regarding this. And so at the present time, there are, I believe, 8 different vaccine molecules that are in different phases of drug development. And allow me to give you a little bit of an idea about vaccine development and drug development. It's a multi-step process that most of us are not aware of. And as you've got a problem, as you've got a disease that's identified that deserves focus, and in this case, RSV, the solution here is probably not so much treatment, but rather focusing on prevention. The old adage, an ounce of prevention is worth a pound of cure. I think my comments earlier about all those diseases that have been prevented, and the millions, hundreds of millions of people whose lives have been saved, and maybe more importantly, their quality of life has been dramatically improved because they didn't get polio, because they didn't get rubella or tetanus. Let me, well, I'll come back. I was going to do a sidebar, but I'll come back to that. Those diseases and the prevention that a vaccine provides is so valuable. And so that is where the drug development process is, an awful lot of energy is being put into that. And so, yeah, those 8 different vaccines are in different phases of development. And during that drug development process, the first part is in the laboratory. And I'll try to go through this real briefly. It's complex, but I'll try to be brief. The laboratory process is first. They identify the molecule, they identify the potential treatment, and then it is refined. They use sophisticated computer algorithms to try to map these molecules, figure out what the right shape is, what the right action will be. And then they take it to animal models, i.e. mice, rats, and then they move it up even to the complex primates, i.e. monkeys, chimpanzees, etc. And then once they figure out that this treatment might work or this vaccine prevention might work, then you start the human clinical trial process. And in that process, there's four basic steps, four phases, phase 1, 2, 3, and 4. And in phase 1, you take just a tiny cohort, tiny number of individuals, and it's not to prove that it works, but just to make sure that it doesn't kill anybody. And you've got to be very brave to do a phase 1 trial, but we've learned how to do it safely and within the guidelines of good ethics. And then once you demonstrate that you're not going to hurt people, or it's not absolutely you're not going to hurt, but that the risk has been minimized, then we go on to phase 2 and 3. Phase 2 is now the point where we try to demonstrate that there is good reason to believe that this is going to do what we think it's going to do, i.e. prevent the disease. And then once you get through a phase 2, then you broaden it out and you do a randomized prospective phase 3 trial. That's where you've got standard treatment, in this case with RSV, nothing, versus another group randomized to get the vaccine. And then these two groups are followed over time. And hopefully we demonstrate that the group that gets the vaccine does better, lives longer, doesn't get the disease.
Mhm.
And that drug development process, that's the third step, those clinical trials that I just mentioned. And that's where every one of our attendees today could participate, because these drugs, these vaccines for RSV are being developed right now, as are many other vaccines. And in order for us to get from no vaccine to one where we are with COVID-19 or pneumococcal vaccine or any of the other vaccines, I think we've got 17 right now that are approved to prevent disease. In order to get to that point where we know we have a product that is safe and effective, we have to have the support of the community at large in order to conduct these phase 2, 3, 4 clinical trials to demonstrate that this does what we think it should do and doesn't hurt people. And many of our listeners may have participated already in clinical trials, especially with COVID-19. And as we go through this pandemic, there will be many opportunities to participate, not only with RSV vaccines, but COVID-19. And for instance, my clinical research practice, Be Well Clinical Studies, we are actively participating in 4 vaccine trials at the present time, and we are opening up a RSV vaccine trial in the greater Austin area, hopefully in April.
Wow, I had no idea.
Yeah,
I mean, that's huge. Yeah.
Yeah, these clinical trials are, they oftentimes fly under the radar. But we're learning that we have to educate the population, educate the public about the need, and that's part of our mission as physicians, to be part of this process, not only to apply the proven treatments once they've completed the drug development process, i.e. Any of the treatments that you can go get at your pharmacy today has been through the drug development process in the past. And as an oncologist, I learned that not only did I want to be part of that process of applying the cure, but I also wanted to be part of the process of developing the cure. And during my years in oncology, I gained a lot of experience in this clinical trial process. And then when I shifted over to geriatrics, I realized that I could take that skill with me and apply it to so many areas within geriatrics, not only prevention, but also diseases like dementia. Dementia is a disease that does not have a disease modifying drug. And this is another one that the pandemic has affected because it's kind of shut down a lot of the research into dementia. But we're actively participating in those trials as well.
So with the RSV trial, what level trial is it at? Because I understand the one is kind of the scary one. And
Yeah, exactly. So out of the 8 drugs that are in the pipeline right now, they vary anywhere from phase 1 all the way up to phase 3. And so we are participating with Bavarian Nordic with a phase 3 trial. In other
Okay.
words, they've already gone through phase 1. They demonstrated that they're not going to kill too many of us. And I'm sorry if I'm being jocular about it, but anyway, they proved that it's safe to give to humans. And then they went on to phase 2, and the phase 2 trial, I believe they had about 350 participants. And in that trial, they demonstrated a reduction in the risk of RSV infection. And so then once that phase 2 data was available, now they go and broaden it out and do that randomized prospective A group versus B group. And that's what we will be participating in. And this trial is just being organized, the protocols written, and we are one of multiple sites across the country that will be participating in this. And again, we should be enrolling subjects by the middle of April.
so to me, it's kind of like people who go to war, to help support the country. Doing these trials, in a lot of ways, you're helping the entire the world, by doing it. It seems like a really great thing to do.
Yeah. Going to war. That's a good analogy. I hadn't thought about that before, but in a sense, yes. Those soldiers are going to help their country. As a participant in a clinical trial, you are doing it, the way I look at it, you're doing it not necessarily for yourself. While you may get a benefit, the real benefit is for those that come after us, i.e. our children, our grandchildren, our younger neighbors, our younger friends. They will benefit from your participation. It is an altruistic participation. There's no guarantee that you will benefit, but your time and energy participating will help others, whether the clinical trial is a positive one or a negative one. If you participate, you will absolutely help the advancement of medical science, because whether we learn a new treatment or not, we figure out where to go, the right place to go. But oftentimes, just as important as that is where we shouldn't go. Find the direction that we shouldn't waste our time and energy, because there are so many of those that if we don't focus properly, we're going to waste our resources.
So that's for RSV. That's number 1. You said you've got 4. So what are the other 3 things that people could participate in?
Oh, I just meant, I think right now we have got 4 other vaccine trials. Another one is a maternal RSV vaccine. And that vaccine would not be proper for this population. It's for young pregnant moms.
Okay.
So in other words, we're approaching that infant problem through the mother, i.e. vaccinating mom before delivery so that her immunity can be passed on to the infant to prevent the RSV infection after birth. And
wow.
So that is one trial that we're doing. Another one is a meningococcal vaccine that is being administered to adolescents aged 10 to 25. Meningococcal is another disease that we've already got a vaccine proven, but it's not perfectly effective. And so this trial is trying to make that vaccine better.
Okay.
And then we've got a meningococcal vaccine that we are applying to the elder population. So that might be something that people if they're interested, could could inquire about. And at the end, I think Anne has our contact information about that.
So
But
for
anyway,
any of these, would they contact you directly, or can they go to a website, or how do they learn more about participating in your clinical trials?
yeah, if they go to our website, Be Well Clinical Studies, or contact us by telephone, then we would do the screening and let them know whether or not they would be able to participate. These trials have to be very strictly and rigorous in our admissions, and it's called inclusion and exclusion criteria. So if somebody is interested in participating in a prevention trial like this, or a treatment trial for dementia, say, their participation is welcomed, and we want them to be part of it. But don't be surprised if the first time you try to participate, you can't because of some sort of inclusion or exclusion criteria. And so for those that want to be part of this drug development and solution process, what I tell people is just be persistent, because if you don't have a trial that you can be part of today, almost certainly in the near future, something will become available.
I know one of our topics in the past is living, dying, and leaving a legacy. And as we age, you want to have made a difference, and leaving a legacy could be participating in these kind of studies.
Yeah.
So,
look at the work around polio. I suspect many of in our audience are perhaps old enough to remember polio, but maybe not know, though it's so long ago, the 50s and 60s with the iron lung and those polio victims. I have never seen a case of polio, and as of about 15 years ago, it was the first disease that was eradicated, we think. And so the only polio virus that is still around is in a laboratory. And heaven forbid that would ever get out again. But it just demonstrates the ease with which we forget, because nobody thinks about polio anymore. But in the 1950s, there were hospital wards filled not with COVID-19 patients, but with people in iron lungs. And those people didn't spend a week or a month there. They spent the rest of their lives there. And we don't have to deal with that anymore because of these preventions that are so enormously valuable. These preventions, again, the return on investment within medicine, vaccines, I don't think there's a comparison. Now, maybe morphine to prevent pain. You might be able to make an argument that has as much value as the vaccines do. But I don't know. I don't think so. I think it's vaccine prevention that has the biggest ROI.
well, I'm curious why you're doing this new business in Austin. Tell me what the draw was to have the clinical trials set up in Austin and not in.
Oh, Cindy, we don't have enough time for that story. But
well, because we live in Austin. I'm like, why Austin?
Okay, so 15 years ago, I had a significant event, a personal event in my life, a health crisis. And that was the start of this, really, because then I rapidly learned that I needed to refocus my career from medical oncology, where I was slowly but surely killing myself because of the stress associated with that practice. And so I refocused my career in the world of geriatrics. And for those of you who don't know, geriatricians are the happiest doctors. I don't know why that is. I have a suspicion, but that's a whole nother topic. And so I found a space that I think I was good at, or could be good at, and where I could make a difference. And through that process, I planted Be Well MD in the greater Austin area, because even though it has the reputation of being a young, hipster, weird town, it is the second, I think it's still the second fastest elder population, or fastest growing elder population in the country. And not many people know that because of its reputation. But because of that, I decided to plant Be Well MD, my geriatric medical practice, in the greater Austin area. So nearly 8 years ago, I uprooted my family and relocated to the great state of Texas. And I will always be a Texas resident from now on. So I'm a Texan. I'm an adopted Texan, but I'm a Texan.
Well, I wondered if it was because of the great population numbers too, just because that would be good for clinical studies, because we are known for that. And I think we will continue to be known for that.
Yeah, no, exactly. And, Austin has grown so rapidly, and that population growth does mean that there is a great opportunity for the Austin metropolitan area to be a leader in drug development and be part of these cures and preventions.
That makes me really proud. Well, I'm looking to see if we have any other questions, and I'm looking in questions. And Natalie, do you see anything that I might be missing?
I do not.
Okay. Well, Dr. Carlson, this was really fascinating. It really was. And I'm just so happy that you could come on and talk to us about RSV and the things that we can do to prevent it now, and then the opportunity for us to participate in clinical trials. And Anne, do you want to go ahead and put your information up so that people can see it, so people could
sure
reach out
will.
and contact? Yeah.
Yes.
And then it's pretty easy. It's Be Well MD, and then Be Well MD clinical studies or clinical trials.
Clinical studies. Yes. Yep.
So, but I know, Anne, you'd be willing to talk to anybody and
Absolutely.
yeah,
Yeah.
we're so excited to be able to participate in this way. I hope that I know you're going to come talk again. You normally speak at least once or twice a year with LT Senior Services. Maybe you can come back and give us an update on what happened and how the trials are going. So, as
Thank
always,
you.
we appreciate you coming.
You're very
All right,
welcome.
everybody. We'll see you in
You're welcome.
February, where we're going to talk about February, the month of love. We're going to talk about love and marriage. It's just not for youngsters. Thank you all for being here. And remember, we're going to follow up in an email, and we'll have our YouTube channel on there. It's easy to find, though. You can go to YouTube. It's LT Senior Services. And you can find all of our past webinars, and the webinar from today, it will be on there. Give us a couple of days to get it posted. Thank you, and we'll see you next month. Bye.